Senator Nash.
Thank you, Mr President. My question is to the Minister representing the Minister for Health, Senator Ludwig. I refer the Minister to the government's decision to effectively deport 80 Australian-trained medical students after its failure to fund their internships and the breakdown in negotiations with the states. Does the Minister agree that people studying medicine in Australia have a reasonable expectation of being provided internships in Australia in order to complete their qualifications?
Good question. The Minister representing the Minister for Health, Senator Ludwig.
Thank you, Mr President. I thank Senator Nash for continued interest in rural matters, particularly in the health portfolio. Can I say that the brief does not have anything specific in relation to this particular matter? Certainly a matter that I will take it on notice and get back to you with a proper brief. It does sound, Mr President, that it would fall more properly within the immigration portfolio as a general response, it is more accurate that these matters. It is more accurate that once we start talking about. So I will get a brief from the Health Minister, but once we start talking about deportation matters, it does seem to be more relevant to the Immigration Minister and decisions made by the Immigration Minister. It does seem, though, that if we talk about the key messages from this issue, of course, is that the Department of Health and the Minister have been very focused on providing support for rural Australia, providing additional measures, unlike the previous government, which ripped $1 billion out of the health system, because what we're looking at is since 2007 we have been delivering better health services for Australians. We've delivered more than 900,000 elective surgery operations, 2.2 million GP super clinics. So, if the substance of the question was really to say that if the substance of the question, was to say that this government hasn't been proactive in the health portfolio, then it would be an error. It would be an error to have that. If you look at the work that the Minister has been doing in this area, particularly increased hospital funding by 50%, and we're investing in emergency departments upgrades at 37 hospitals, then it would be wrong.
Time's expired, Senator Ludwig. Time's expired. Order. Order. Senator Nash.
Thank you, Mr President. Is the Minister perhaps then aware that the Health Minister, Ms Plibersek, said on ABC Newcastle that part of this is a good news story? Can the Minister explain what part of sending Australian internships overseas is a good news story? And what is the point of training more medical students through Australian universities if they can't finish their training in this country?
Order. Order. The Minister. Order. The Minister.
Thank you, Mr President. Today, I thank Senator Nash for a continued interest in rural health matters. In this instance, Senator Cash, I should say, you're sitting very close together, I see. But the Commonwealth funding, if we talk about additional internships, Commonwealth funding may be available to fund the additional 100 intern positions in the private sector through the redirection of $10 billion from the pre-vocational general practice placement. But it goes to the heart of what I said earlier. If you look at what this government has done, particularly around providing training, higher education reforms have resulted in 150,000 students attending university. Health disciplines have experienced substantial growth. This includes growth between 2007 and 2011. There's been a 39% growth in the number of medical students. I think Senator Nash, in this instance, is looking at the wrong end of this
Time
stick.
has expired, Senator Ludwig. Senator Nash.
Thank you, Mr President. Given that the shortage of medical practitioners in regional Australia has been estimated as high as 1,600, how can the government possibly defend its internship decision, considering the cost of fixing the problem is only $8 million, or about 1/10 of what Labor spent advertising its carbon tax compensation?
Order. The Minister.
Thank you, Mr President. I thank Senator Nash for her interest. As I was saying, the Commonwealth funding may be available for the
Senator
additional—
Ludwig, just resume your seat for a moment. I need to hear the answer on both sides. Senator Ludwig, continue.
No. Mr. President, if we do want to talk about advertising, if you look at the Howard government's last year in office, they spent. I think my recollection is, and I'm happy for Senator Brandis to correct me, something in the order of $275 million on advertising. So don't lecture us on advertising, Senator Nash. If you look at your record, you'd be very shocked, I suspect. But if we go to the substance of the issue, Commonwealth funding may be available for the additional 100 internships in the private sector through the redirection of $10 million from the pre-vocational general practice placements program, and this can be achieved by reducing the number of it's a long acronym, but PGPPP placements in 2013.
Time has expired, Senator.